In 1932, in the rural heart of Macon County, Alabama, 600 impoverished African American men were approached by government health officials with an extraordinary promise. They were offered free healthcare, free meals on clinic days, and burial insurance in exchange for participating in a medical study. Most of these men were sharecroppers who had never seen a doctor in their entire lives. They were told they had a common regional ailment vaguely referred to as bad blood, an umbrella phrase used to describe everything from severe fatigue and anemia to sexually transmitted infections. Trusting the white coats and government badges, they gladly signed on. What these men were never told was the true scientific objective of the study. 399 of them had confirmed active syphilis, while 201 served as healthy controls. The researchers had no intention of curing them. The entire investigation was designed to observe the natural, unhindered progression of untreated syphilis until the death of every single subject. To keep the men compliant, doctors administered diagnostic spinal taps, deceiving the patients into believing they were receiving special spinal treatments. They handed out vitamins, aspirin, and placebos, ensuring the participants felt cared for while their bodies slowly deteriorated under the bacterial infection. By 1947, medical science underwent a monumental revolution. Penicillin was discovered and universally proven to be a 100% effective, fast-acting cure for syphilis. Across the globe, standard medical practice shifted immediately to treating every infected patient with antibiotics. Yet, in Macon County, the researchers made a horrifying decision. Rather than administering the cure and ending the study, they actively withheld penicillin from all participants. When men were drafted into World War II, researchers intervened with the Military Selective Service Board to prevent them from receiving mandatory penicillin treatments. Local doctors were provided lists of the subjects and instructed never to prescribe antibiotics if they showed up at outside clinics. The study continued undisturbed for 40 years. Men suffered severe tertiary syphilis complications, including blindness, cardiovascular aneurysms, severe neurosyphilis, and dementia. Many died directly from the illness, and the infection was passed unknowingly to their wives and congenital offspring. In 1966, Peter Buxtun, a young public health service venereal disease investigator in San Francisco, discovered the study records and raised moral objections. For 6 years, federal committees repeatedly rejected his concerns and ordered the study to continue until all subjects passed away. Refusing to remain silent, in July 1972, Buxtun leaked the entire archive to investigative journalist Jean Heller. The story exploded on the front page of the Washington Star, sending shock